Hey everyone, welcome back to HD Reddit Reads. Today's topic is Doctors of Reddit, what's the biggest case of faking it you've ever seen? Let's get into it. Ophthalmology technician. People pretend to be blind all the time. Go to check their eye pressure with a tonopen, a device you poke them directly into the eye with, and they go, "What the F is that thing?" When I worked family practice admin, the clinic I was working in was A, in the country, B, had been passed along through various doctors over the years, starting from about 1960, and the old tonometer they had looked like something from the Middle Ages, and the general opinion of the clinic was that it doesn't get used anymore. It was like a museum. The previous doc never got rid of anything, so you had drawers filled with metal aniscopes and things. Fourth year medical student. On my ER rotation, a trauma came in from a woman that had been arrested. During the drive, the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled BS, but the patient was a great actor. Didn't even flinch during the digital rectal exam, which is standard for all the patients that come through the trauma bay, though some of the nurses said they caught her peeking at us when we would leave the room. We ended up getting a CT scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened the eyelids, and held them open while telling her to wake up. Finally, she started fighting to close her eyes, and the jig was up. The doctor called her out, and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. Had a patient when I was an intern feigning blindness, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hands up in a highly exaggerated hello wave. She started to throw her arm up, but then caught herself halfway through and threw her hand back into her lap and pretended to be staring off into nothing. Not a doctor, but I'm a UK-based midwife. Had a patient who had been in and out of the hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was no one had ever seen her actively bleeding. She'd call us saying that she'd bled down the toilet but flushed it, and all the examinations we did came back completely normal with almost no evidence of any bleed whatsoever. On occasions during speculum examinations, we seen smallest amounts of blood. I was caring for her during a shift where she had yet again called to say she was bleeding. Walked into her room and found her jabbing around her vagina with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave? Because she had 5 noisy children at home, needed some rest, and knew we wouldn't admit her to the hospital if it wasn't for a good reason. She would do it any time her being discharged from home was mentioned. We ended up having to complete a perinatal mental health referral and consult with a safeguarding midwives as she was putting herself and the baby at risk or serious harm. I once saw a patient who had been faking paralysis of the legs for years. Used a wheelchair, never walked, etc. Old records showed extensive imaging, neurology consults, and other tests that proved the patient had full function of all extremities. Family/friends were going along with it. Not sure if it was really conversion disorder or if the patient had some secondary gain issue. Years ago, I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual "I'm crippled" paraphernalia: crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple times and she showed no improvement. One Saturday I was on a call, but I had to take the back streets route to the hospital because of an event taking place on the main street. I apparently drove through her neighborhood because, wonders behold, she was wearing an old lady spandex powder walking down the sidewalk, holding weights in both hands. I did not call her out. Next week she was back in the clinic with her "I'm crippled" get up on again. A few weeks later I got the subpoena for the deposition, and it all became clear. My cousin got glasses. Her 7-year-old sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teachers she couldn't read what was on the chalkboard, and she'd squint at home and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. Everyone seemed convinced that she needed glasses, but the doctor was a little concerned because the tests indicated she needed really thick glasses, and usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision, and her sister only had astigmatism. They all realized she was faking it. So the doctors told her parents in front of her that she'd need some pretty intensive eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all, and started to cry. She got grounded for a while. Obligatory, not a doctor. I'm a nurse. We had a guy come in every 3 months to get a medical certificate to say he couldn't work at a retail job due to severe disabling back pain. He was receiving large amounts of insurance money for this condition. After the doctor had done his usual examination and questions and signed it off, the guy asked the doctor to check his shoulder, which the doc does, and asks how he got it injured. Guy says playing rugby for a competitive team. Really, says doc. How long have you been playing on the team? Guy has been playing and training the whole time. Doc puts this info on insurance form. Doc loses his shit in staff room laughing. Next week, the patient loses his shit in reception because insurance has been canceled. A guy came to ER, I was a nurse at the time, for a stomach ache. When asking him about his history, he randomly mentions the fight with his girlfriend where she left in a tizzy and he fell asleep on the couch. 20 minutes later, when we see the CT, he has a satellite cable remote wrapped in a condom lodged in his rectum. I suppose he intended to frame her. Didn't get to hear the conversation he had with the doctor. I was curious how he was going to explain why she was nice enough to wrap it in the condom. This patient comes in for back pain with weakness of the legs. Gets a full workup with MRI, and then some immunological things to look for. No neurological or immunological explanation for the weakness. Patient is seen by physical therapy, and they are of the opinion that the patient is holding back intentionally. Go to see the patient at the end of the day and prep them for discharge. Patient is infuriated that they're being discharged, yelling and screaming about how they aren't better, and that they're disappointed in the institution, blah blah blah. They said one particular thing that clearly stands out 3 to 4 years later. I can't believe you're sending me home already. I haven't even told my family I'm here, and you're going to send me home before they even have the chance to see me? My attending and I leave the room to arrange things for the nurses. We go back in, and the patient is out of bed and standing up in the middle of the room. Miraculously, the patient is able to walk with zero assistance when they had such a difficult with any assistance over the previous 2 days. At that point, they were enraged that we went into the room without knocking. They were discharged home after a conversation regarding abuse of medical services. Late to the thread, so this will probably get buried, but I'm a resident, not psych resident, but this happened in my psychiatry rotation in medical school when I was in medical school. There was a patient in the inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with fictitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had a lot of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously. So the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist, and her primary goal was attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. Thank you for listening, everyone. If you enjoyed the content, please consider subscribing. It'll be greatly appreciated. And if you want to visit the original thread, I'll link it in the description. But yeah, that's it. I'll see you guys in the next one.